welcome to our latest Bite-Sized Science talk. I'm Dr. Ruth Peters. I'm an associate professor at University of New South Wales here in Sydney, Australia, and I work at Neuroscience Research Australia as well. And I'm super delighted today to be talking to Dr. Stephanie Ward, and I'm going to hand over in a second for her to introduce herself, and then we're going to have a chat about what we do if we've got memory problems or problems in thinking and how we handle those. Okay, so Stephanie.
Hi, I'm Dr. Stephanie Ward. I'm a geriatrician, so that means I'm a specialist doctor for people who are aged over 65 years old. I work at Prince of Wales Hospital, where I work in the Cognitive Disorders Clinic, which is a specialist clinic for people who are worried about their memory or thinking, or people who have a diagnosis of dementia and need some specialist help in managing that. And like Professor Peters, I'm also a researcher. I'm a senior research fellow at Centre of Healthy Brain Ageing at University of New South Wales.
Fantastic, thank you. So you're really, really well placed. You're seeing people all the time doing these kind of assessments. So like this is really kind of close to my heart, because I've had family that have had memory problems, like a lot of people, I think. So, you know, if I'm having problems with my memory, or I think maybe it's not as good as it used to be, or I'm having trouble with other kind of thinking skills like planning maybe, or, you know, organizing my life, and I'm a bit worried that something might be wrong, what do I do? You know, what's my first port of call?
It's a great question, because a lot of people, particularly as they get older, do start to notice some changes in memory and thinking. And some people maybe notice that these changes are a little bit more than their friends, or we're just worried about it. And we might be worried because we've seen changes in our family. Perhaps our parents had dementia when they got older. So a lot of us can get a bit worried, and we're not quite sure, is this normal part of aging, or is this something else? And the most important thing to do is to go and see your local doctor, your GP, to have a chat about this. Because it could be a variety of reasons why memory and thinking changes as we get older. When we get older, our brains do become a little bit more vulnerable to other things happening. And so sometimes we'll have change in memory and thinking because of the side effects of certain medications. Perhaps if we're experiencing depression or anxiety, that can affect our thinking too. But we won't know unless we go and see a doctor and have a good assessment. And when you see your local doctor, what might happen is a brief memory or thinking test. And your local doctor might do a brief examination and also organise some blood tests, because sometimes even some hormonal changes or changes in vitamin levels in our body can affect our thinking as well. Often your local doctor will also organise a quick scan of your head if you've not had any. And that's to make sure that there hasn't been a stroke that's happened that you had no symptoms from. That happens more often than we think, or other structural changes in our brain that might be explaining those memory or thinking changes. And sometimes your GP will be in a position to give a diagnosis and perhaps work out what's happening. But quite often your GP might want another opinion, or someone to spend a bit longer working through what's happening. So a lot of people might get referred on to a specialist service, and that might be a neurologist, a specialist in brain. It might be a psychiatrist, or quite often, particularly for older adults, it's a geriatrician, someone like myself.
Okay, great. So actually there could be a whole lot of different things happening. And so to take the first step, I really need to start understanding which ones of those it is before we can tackle them.
Absolutely. I think that's really important, because some people get very worried that they might have a dementia, but it's not a dementia. And unless you go and see a doctor or a professional about that, you won't know. And you also are missing out on an opportunity to improve your thinking and probably improve your anxiety about it as well.
That's a good point as well, because a lot of it is a lot of us get worried about things changing with our memory and thinking skills. Okay, so if I've been to the GP and the GP's referred me on to someone like yourself, what should I expect? Like what kind of, because this can be a little bit daunting, right? What kind of tests would you want to carry out? You know, am I gonna have to do lots of complicated memory tests? What would you do routinely, you know, if I came to see you for an assessment?
Ruth, that's such a good point, because I think most of us get really anxious about the idea of coming in and seeing a doctor and doing tests. It's really nerve-wracking, and perhaps finding out that there might be a problem, but also the idea of tests is something we do at school and we don't want to fail. So it is natural to feel a little bit anxious. And I guess the message I really want to reassure everyone is that there's no passing and there's no failing. And we're professionals, so we're used to the fact that people come in and might be feeling a little bit anxious, and we know what it's like. We're there to see, okay, you're a bit worried, you've noticed some changes. So when I sit down with you as a doctor, do I notice those changes as well? Because if I don't notice them, then we've already got a few answers. If I do notice them, then the next question I have is, well, what could be causing those? And so as a partnership between myself and my patient, we'll try and work through that. And it might be, as I said, sometimes it is a mood issue or an anxiety issue. It might be a medication issue or another health issue. And sometimes it could be something like a dementia as well, but that's important to find out. So usually when you come and see a specialist, it's a longer appointment than with your general practitioner. And there should be an opportunity for you to explain what you're worried about. And also to find out, the doctor will ask about your other medical history. And some type of memory or thinking test will usually be done as part of that assessment. And it really is just to get a ballpark to work out what are the areas that are a worry for you and what are the areas that are not at all. And there are so many different parts of our thinking and our brain that we use, and we tend to forget that. So we might get caught up on the fact that we've got a poor memory, but we might have excellent language skills, excellent planning skills, excellent attention. And it's really nice sometimes when people come out and think, wow, I'm actually really good at these parts of my thinking. The doctor might then be in a position to give you information about what's happening, but usually more information is required. And often what happens at one of these specialist assessments is that the doctor, with your permission, will ask if they can get some observations from somebody that knows you well. So that might be someone you live with, like a spouse, or someone, or a child, or it might be a really good friend who spends time with you. And that can be really important, because we've always got an impression of ourselves, but often it might be other people around us who have a different impression of us. So, you know, sometimes I see people who are very conscious of slight changes in their thinking and are very worried, but people around them aren't noticing it at all. And sometimes it's the converse as well. Sometimes we're not aware so much of our memory and thinking problems, often because we're forgetting them. And it might be the people around us who are more observant and can give more information. So with all of this information, the doctor might be ready to make a diagnosis, but sometimes they might recommend additional assessments just to make sure that they're on the right track. So that might be additional imaging, or like an MRI, a special scan of your brain, or other types of special scans of the brain. Or sometimes it might be more detailed memory and thinking testing as well, particularly to get a better understanding of people's weaknesses, but especially their strengths, to look at strategies to help you. And then you might come back and have an opportunity to talk to your doctor about what might be happening and what's going to be the plan from here to make life a bit better than it has been. So that, in a nutshell, it's probably not much of a nutshell, it's a big nut, I think. That's what to expect when you come to see a specialist when you're worried about your memory and your thinking.
So thank you so much. And that's super reassuring, the idea that really this is about exploring all the different potential pathways that could be driving what's happening and really trying to understand it to take the next steps. And I guess that kind of naturally leads me to the next question was, you know what, if I do get a diagnosis of dementia, then what does happen? You know, are there things that I can do after that point? You know, what's the next stage once I've had all of these, you know, investigations and we've got the answer?
Yeah, that's a great question. And it is a big diagnosis to take on board. And really, in the first instance, you need to have time to understand that and to process that, to understand what dementia is and what it means for you. Dementia is a clinical syndrome. So that means There's not a blood test or a scan that says, yes, you have it, and no, you don't. And there can be lots of different reasons why people have dementia. So some of the more common causes are things like Alzheimer's disease, in which protein aggregates or little bits of protein gathering, particularly in the parts of the brain important for memory, but then can affect other parts. But there can be other reasons why we get dementia as well. So blood flow changes or strokes or little strokes is what we call vascular dementia. And some people get dementia as part of living for a long time with diseases like Parkinson's disease as well. So getting an idea of what might be the reason for you can also help understand what's happening, and getting some information about dementia is really the first step, because it's a big thing to take on board. And like any big diagnosis, you really need time to adjust to that. And then the question is, all right, well, is that it for me? Is there anything we can do? We can't do anything. That's not the case at all. So in fact, getting a diagnosis of dementia can be really, really helpful. First of all, it helps to understand changes that have been happening up to that point. So nothing's changed there, but now you as a person and your family can understand why things have been happening. It's not your fault you forget things. It's not that you're not intelligent. It's that those parts of your brain that are important for memory, or perhaps other parts of thinking, they're letting you down. And now that you know that, then you can work around that. So what can be important is adapting your lifestyle to living with some changes in thinking. It's just like when you have a computer and sometimes you need to put things on an external hard drive, right? So if your memory is something that lets you down, well, use external hard drives around you. So a calendar to help you remind you of what day it is, what appointments are coming up, a notepad to write down messages that you get from the phone, a diary to keep track of things. If medication and remembering to take medications is an issue, having your tablets organized into a pack, a blister pack, so that you just know, morning, lunchtime, dinner, Monday to Friday. And also having people around you help your memory and be aware of that. So instead of getting frustrated if you ask the same question, understanding it's not your fault, and you're going to ask that question a few times. So that's really important. The other things that are important is making sure that your health is as good as it can be, because the healthier your body is, the healthier your brain is going to be. And does it make a difference to the progression of your dementia? It does. So all those things that we know that are important for helping to prevent dementia in the first instance are probably important for ensuring that your dementia progresses as slowly as it can. So physical exercise is the big one here. Doing something that gets your pulse up, as well as uses your muscles. Even just standing and sitting and standing and sitting from a chair, using your big hip muscles there, that seems to be really helpful to your brain's health. And maybe getting some dumbbells and having them near the kettle and using those to move your upper arm as well. But doing physical exercise definitely helps get our blood flow. And we know from lots of scientific studies, it's incredibly good for your brain. The other things that are important are making sure that the medications you're on are the best ones for your thinking. You're not on medications you don't need to be on, and you're on the ones that would be helpful for your thinking as well. Making sure your blood pressure is where it should be. Not too high, not too low either. Making sure that your cholesterol levels are being checked, and that if you've got diabetes, that your control is as good as it can be, because all of these factors are really good for keeping our brain as healthy as possible. And something that's really important is that you keep enjoying your life, and you keep living your life, and you keep having fun. And I can't tell you how important that is. And there's absolutely no reason why you shouldn't be enjoying yourself and doing new things and having fun just because you have dementia. And it makes sometimes people feel a little bit awkward about the diagnosis, or sometimes embarrassed. And it is hard to, it's a big thing to process. But being connected to others, being socially connected, trying new activities, perhaps joining a new club, perhaps keeping up friendships or looking at new avenues to make new friends. This is actually really, really helpful for our brain. You know, we talk about the importance of stimulating your brain. And there's probably no better way of stimulating your brain than being with other people and being in contact with other people. And sometimes there might be other strategies that can help as well. So things like online computer brain training might be of interest. The advice I give people is do things that interest you, you enjoy, and you find fun. Sometimes there might be, your doctor might also talk to you about a couple of medications that are on our PBS list that are available for people with certain types of dementia that can help symptoms in some cases. And these medications might keep things at bay for a period of time. And they don't help everybody, and they can have some side effects. But for some people, it can make a big difference to quality of life and to confidence. And again, that's something you can't access without getting a diagnosis. And I've seen people who've been worried about their memory, and we have confirmed a diagnosis of dementia, and we've made some changes to lifestyle and strategies, and we might have started one of these medications. And when I see these people again, life's gotten a lot better. So I think that's something that's really important to take on board, that it's not always a bad news outcome, that you can improve things in that short term by understanding what's happening, by treating things properly, and by being able to take control of what's happening. I guess after a diagnosis of dementia, it is something that we live with and we're going to continue to live with. So we need to plan for the future as well. So it can be really important to start thinking, well, if my memory and thinking is going to change maybe over the next few years, are there things I really want to do now in case that changes? And that can be a really introspective time for people, but that's important as well. Sometimes organising things now for the future can also be a way of taking control. So that can be things like organising someone you trust to be the manager of your finances, but perhaps not now, but you know, whenever you need it. Having earmarked that person and done the paperwork so that that's all sorted out. Same for medical decision making. Same for decisions about where you live and what services you get. If you're worried that in a few years you might not be able to make those decisions in your best interest, having someone you trust authorised to do that is a way of taking control. So these are things like enduring powers of attorney, enduring guardianship. And sometimes it can be a good idea for any of us when we get older to think about medical treatments we do or do not want to accept in the future as well. Something called advanced care directives and advanced care planning can be very helpful. And I guess also there are other opportunities around, there are services around that can help us manage with dementia as well. So these are services that are really focused on what we call re-enablement or rehabilitation type services. And why not? We offer all of these services to people after things like stroke or other big medical events. And what's really wonderful is an understanding now that people with dementia probably should be getting some of these services as well. So some local services, particularly in our area, do have programs that are aimed at setting goals for people and working towards those goals for people with a new diagnosis of dementia in the early stages. There are other support services that can help us and also help our family adjust to a diagnosis of dementia, such as Dementia Australia, a wonderful consumer organisation that offers a post-diagnosis support service now, and some other services as well. That was a really long answer, Ruth, and a lot to take on board. But there's so much that can happen once we understand what's happening with our health. And once we understand what's happening with our health, then we can look at whether there's medications, whether there's social supports, whether there's changes we can make to our lifestyle, whether there's things we want to do now for the future. And nothing needs to be done all at once. We can always take our time with these things as well.
Thank you so much. That was a fantastic answer. And I really liked your summary at the end. So really, it's a hard diagnosis to process for sure. But there's a lot that we can do after that point in terms of how we manage our lives and what we can do to help really, protect our brains as best possible going forwards, and plan, of course, for the future. That's fantastic. And that was so in depth. That's brilliant. Thank you. I guess one of the things you mentioned earlier, and that is that sometimes we ask others, we might ask people that are close to us to comment on our behavior. And that makes me wonder also, how do we, how might I handle the same questions if I'm concerned about someone else? So we started this discussion with me asking you, I have a memory issue, what do I do? What if it's not me? What if it's a partner or a friend or a parent that I'm worried about? How should I approach that?
Yeah, that's a really, really good question. And quite often that is the case. And quite often, if our memory and thinking is changing, sometimes we're not aware of that. And it's the people around us who are aware of it. And if we're not aware of it, and somebody tells us that there's something wrong with our memory and thinking, we're going to say, no, there's no problem. There's something wrong with you for thinking that. And that's quite a common dynamic. And it can be more difficult to get somebody to come and see a doctor. Sometimes having a conversation with that person's local doctor is a good start. There are also good resources through consumer organisation Dementia Australia. And I would tell you that general practitioners, and especially specialists like myself, we're very much used to meeting and assessing people in which there isn't a sense of it being a problem. Sometimes it can be helpful to talk about going to see a doctor for a general health review, because any good doctor, like a geriatrician, actually we do that. We don't just think about memory and thinking. When I see somebody, I look at everything and work out what's happening. And look, sometimes it is difficult, and sometimes we're just in the situation of trying to manage a situation. But there are supports available. So Dementia Australia, sometimes getting support through My Aged Care, talking to your general practitioner, and often trying to get an assessment with a geriatrician, perhaps for a general health review, in which case it can be sensitively brought up. And medical professionals and clinicians that work with people with dementia are quite experienced in this situation and are quite experienced in working out what to say and how to say it. In general, if we think that somebody has dementia, we do want to tell that person. We almost always will, but we'll talk about it in a way that is truthful. And I think the general public have some expectations about what dementia is, and it might be very different to what it really is. And I think the other thing to remember is that dementia is not a normal part of aging, but the older we get, the more likely it is that we're going to get it. And if you're a woman and you're aged 85 and above, it's about 1 in 3 of you are living with dementia, and you're in good company. When you're in your 90s, it's about 2 in 5. It's not something shameful that happens to so many of us. As we get older, so many different parts of our body systems might change. And, yes, for some people it's dementia, and for other people it's around mobility or vision or hearing, and it's a nuisance, and we've got to adapt, but there's no shame in it. I can't reiterate that enough. And I also can't reiterate that it's not reflecting, you on as a person or your intelligence, because I love my job, and I get to meet so many witty and articulate or funny or intelligent people living with dementia. And life goes on, and life can improve once you understand what's happening.
I think that's a really good point. That this is not uncommon. As we're getting older, it's such an amazing thing that we're all able to reach older ages, but it is something that happens more commonly as we get older, and there's really no shame at all. That's so important, isn't it? And also that that you guys are professionals, and you are trained, and have the tools and the words to be able to talk to people in these kind of circumstances.
Yes.
So yeah, that's just incredibly helpful. I feel like I'm super informed for myself, but also informed so that I'm prepared also if I'm concerned about other people. So thank you so much for talking to me today and chatting about that. Is there anything else that you want to raise now and say to people before we finish off?
Well, thanks so much for the opportunity, Ruth. It's lovely to be able to speak to everybody. And I know a lot of us do worry about this as we get older, and a lot of us worry about it for ourselves. And if we are worried, it's much better to ask for an opinion from your GP or a specialist rather than sit around and worrying, because maybe you don't have something to worry about. Maybe there are ways to make your memory or thinking better. And maybe if it is a dementia, there's ways to take control of your life now and make it better. And same for family members as well. You're not alone. And when it's a loved one and the loved one doesn't want to get help, that's pretty common as well. So talk to your local doctor, talk to other supports like Dementia Australia, or perhaps any other health professional. But certainly professionals like myself, we're used to this situation, and we know how to manage it in a sensitive way that's helpful for everybody. And it's not always easy. And sometimes living with changes that happen with ages, it isn't easy. We can't change that, and we can't stop aging, but there's a lot of professionals around that are trying to make it easier for everybody and to make life better. So that's, I think, really all I wanted to get across.
Thank you so much. And thank you for your expertise today.
Pleasure, Ruth.
Thank you.
Bye.